If you're over 50 and taking amlodipine, losartan, or lisinopril for blood pressure, there are 9 things your doctor may not have had time to fully explain, and some of them could make the difference between these medications working well for you or working against you. Let's go through all 9, because what you don't know about these drugs can quietly affect your energy, your kidneys, and even how well the medication actually controls your blood pressure. Before we start, drop in the comments which medication you're on and how long you've been taking it. I read every single comment. Number 9. These 3 drugs work in completely different ways. Amlodipine is a calcium channel blocker. It relaxes blood vessel walls by blocking calcium from entering muscle cells. Losartan is an ARB, an angiotensin receptor blocker. It blocks a hormone that narrows blood vessels. Lisinopril is an ACE inhibitor. It stops your body from producing that same narrowing hormone in the first place. Sometimes doctors combine 2 of these because they attack blood pressure from different angles, which can be more effective than a higher dose of just one. Number 8. Grapefruit and amlodipine don't mix well. Grapefruit contains compounds that interfere with an enzyme in your liver responsible for breaking down calcium channel blockers. This can cause amlodipine to build up in your bloodstream, increasing the risk of dizziness and excessively low blood pressure. If you're on amlodipine, it's worth asking your doctor whether grapefruit is safe for you specifically. Number 7. Losartan and lisinopril both affect your potassium levels. Because of how they work on the hormone system regulating blood pressure, both drugs can cause potassium to rise in your bloodstream. This becomes especially important if you're also taking potassium supplements, salt substitutes containing potassium chloride, or NSAIDs like ibuprofen regularly, since the combination can push potassium to dangerous levels. Periodic blood tests to check your potassium and kidney function are a standard and important part of monitoring these medications. Number 6. Lisinopril can cause persistent dry cough. This happens in a meaningful percentage of people taking ACE inhibitors, caused by a buildup of a substance called Bradykinin in the airways. It's not dangerous, but it can be uncomfortable enough that some people switch to an ARB like losartan instead, which doesn't typically cause a side effect. If you've developed a cough since starting lisinopril, it's worth mentioning to your doctor rather than assuming it's unrelated. Number 5. Amlodipine commonly causes ankle and leg swelling. This happens because of how it affects the small blood vessels, not because of fluid retention in the way a kidney or heart problem would cause. It's usually more noticeable by evening and can often be reduced by elevating your legs and staying active during the day, but it's still worth reporting to your doctor to rule out other causes. Number 4. These medications interact with how quickly you stand up. Blood pressure medications can make orthostatic hypotension more likely, a sudden drop in blood pressure when moving from sitting or lying to standing, which increases fall risk significantly in older adults. A simple habit that helps. When getting out of bed, sit on the edge for 30 seconds before standing fully, giving your circulatory system time to adjust. Number 3. Never stop these medications abruptly on your own. Suddenly stopping blood pressure medication, especially after long-term use, can cause a rebound effect where blood pressure spikes higher than before you started treatment. Any changes to dosage or discontinuation should always be done gradually and under your doctor's supervision. Number 2. Hydration and salt intake still matter, even on medication. These drugs don't cancel out the effects of a high-sodium diet or dehydration. They work alongside your lifestyle, not instead of it. Staying appropriately hydrated and maintaining reasonable sodium intake, as guided by your doctor, helps these medications do their job more effectively and can sometimes allow for lower doses over time. Number 1. Regular monitoring is what makes these medications actually work long-term. Blood pressure medications aren't a set-it-and-forget-it treatment. Kidney function, potassium levels, and blood pressure itself can shift over months and years, meaning dosages that worked perfectly 2 years ago might need adjustment now. Consistent follow-up appointments and home blood pressure monitoring give your doctor the real data needed to keep your treatment properly calibrated. One important note. This video is for educational purposes, and any changes to your medication, dosage, or diet should always be discussed with your doctor first, since your individual health situation matters more than any general guideline. Managing blood pressure isn't about fear. It's about understanding the tools you've been given, so you can use them with confidence. if this helped you understand your medication better. Subscribe and hit the bell icon for more videos like this. And tell me in the comments which of these 9 things surprised you the most. I read every one, and I'll see you in the next video.